Most of us think of sexually transmitted infections as temporary inconveniences, things that might require a quick course of antibiotics and an awkward conversation. But the reality is, some STIs directly cause malignant tumors. Now, a quick disclaimer, we aren't doctors, but the scientific data regarding this threat is incredibly clear, and everyone needs to hear it. Meet the human papillomavirus, commonly known as HPV. It is the most common sexually transmitted infection in the United States. This virus does not care about your demographic. It actively infects males, females, straight and queer individuals, all completely equally. The danger lies in specific high-risk strains, like HPV types 16 and 18. These don't usually cause immediate discomfort. Instead, they can sit dormant in your body for years, quietly altering your healthy cells until they eventually mutate. An infection you contract in your 20s might not reveal itself until your 40s or 50s, acting as an invisible catalyst for a devastating disease. To stop these cancers from forming in the first place, researchers developed the HPV vaccine. Today, the standard shot is Gardasil 9, a targeted medical defense designed to block the virus entirely. This chart shows the efficacy rate of the vaccine against the primary oncogenic, or cancer-causing, HPV strains. When given before any exposure to the virus, the vaccine demonstrates a nearly 100% success rate in blocking the specific strains responsible for most cervical cancers. Looking at this second metric, it also provides virtually complete protection against the strains that cause genital warts. This immunization represents a direct strategy for proactive cancer eradication. For a long time, public health messaging heavily focused on cervical cancer, leading to a widespread misconception that HPV protection is strictly a women's health issue. But data backed by the FDA shows the vaccine actively prevents multiple forms of the disease. It protects against penile and anal cancers, as well as the rapidly rising rates of oropharyngeal, or throat cancers. Because these risks affect all populations, securing this immune defense is vital for men, women, and the entire LGBTQ+ community. The ideal public health strategy is to vaccinate all adolescents between the ages of 9 and 12. Getting the shots before any potential sexual exposure ensures the immune system is fully prepared to fight off the virus on day one. While early vaccination is the gold standard, the medical community and the FDA have approved the vaccine for adults up to age 45 who haven't yet received it. Widespread HPV vaccination established a universal baseline for long-term health. There is, however, a biological limitation. The vaccine is highly effective at preventing new infections, but it is not a retroactive cure, and it does not treat an infection you already have. Additionally, while it covers the 9 most dangerous strains of HPV, it cannot protect against every single viral mutation, nor does it shield you from other sexually transmitted infections. Because of this, vaccines alone are not enough to guarantee total safety. You also need a behavioral defense. Using condoms and dental dams provides a physical barrier. While your immune system neutralizes the specific virus particles covered by the vaccine, the barrier blocks the remaining unregulated pathogens from ever entering your system. This brings us to a critical question. Do you know your vaccination status for HPV, as well as hepatitis A and B? If you aren't sure, it is time to sit down and speak with a healthcare provider. Combining those immunizations with consistent condom use can quite literally save you or your partner from years of preventable misery. Preventing these infections requires a combination of targeted immunization and consistent behavioral discipline.